Diabetes is a chronic or long-lasting health condition that affects how your body turns food into energy. Your body will break down carbohydrates that you eat into sugar and release that sugar into the bloodstream. And when this happens, it signals your pancreas to produce insulin. And insulin kind of acts like a key to let blood sugars into the cells so it can use that sugar as energy. When you have diabetes, your body doesn't make enough insulin or it can't use insulin properly, and too much sugar stays in the bloodstream. Over time, that can cause health problems. So the vast majority of people that have diabetes have what we call type 2 diabetes. That generally occurs in adults, and it's really the type that's related to insulin resistance and obesity. The other type of diabetes that we often talk about is type 1 diabetes. This is an autoimmune disease where your body actually attacks the cells in the pancreas that make insulin. In addition to these, there's other forms of diabetes like gestational diabetes that occurs in pregnancy and rarer other causes that are genetic in nature. So classically, when we think of diabetes, we think of something called the 3 Ps. That's what we think of when we think of symptoms. Polyuria, which is excessive urination, especially at nighttime, polyphagia, which is excessive hunger, and polydipsia, which is excessive thirst. While there are almost 40 million people in the United States that have diabetes, there are over 96 million people that have prediabetes. That's about 1 in 3 people in the United States. Prediabetes itself is a condition where blood glucose levels are higher than normal, but not yet high enough to be classified as diabetes. Regarding the diagnosis of diabetes, there are actually absolute values for the cutoff to make that diagnosis. A fasting blood sugar of 126 or greater, a random blood sugar anytime during the day of 200 or greater, that meets the criteria for diabetes. So does something called an A1C of 6.5 or greater. A hemoglobin A1C actually tests the average blood sugar control over 3 months. All of these tests are easy to do and can easily be performed and ordered by your healthcare provider. While it may not be possible to cure type 2 diabetes, it certainly is possible to control it and to conquer it. So the really fascinating thing about treating diabetes right now in this modern age is that newer medications not only impact the blood sugar control, but they can also have effects on weight management, cardiovascular outcomes, and can be protective for the kidneys as well. Continuous glucose monitoring is a complete game changer for those who have diabetes. Many of these devices can be set to alarm when blood sugars trend up or if they trend down too rapidly, and they can alert someone if their blood sugar is out of control or out of a specific target range. You can certainly have influence and control over the process of diabetes. So a few folks can do this with lifestyle alone, and they've been very successful, and other folks can do it with a combination of lifestyle and with medication.